views for our skull. I'm waiting for my patient. They're getting ready, so we're gonna go check on them and see if they're ready. Okay, so my patient's all ready. I made sure I wiped the board so it's nice and clean for my next patient. My shield is ready, and I have it detented to 40 inches. So let me go grab my patient. Okay, Melendez?
Yes, that's me.
Hi, what's your first name?
Angel.
Perfect. What's your date of birth?
8/17/87.
All right, Angel. So I see we're gonna do some sinus X-rays. What happened today?
My girlfriend beats me.
Oh, that's unfortunate. Okay, we're gonna have you over here. I'm gonna have you sitting down because maybe you're a little dizzy. Is there any possibility of pregnancy?
No.
Okay, perfect. So I'm gonna shield you. You're young, so perfect. And you told me your birth date already?
Yes,
What is
I did. It's
that?
8/17/87.
Perfect. All right. So we're gonna have you put your head up here as close as you can. We're gonna have your IOML parallel to the board here, and it's gonna be to the edge. I'm gonna have the CR entering just a ½ inch to an inch from the outer canthus. Make sure we collimate nice and tight. All right, perfect. All right, so we have a small collimation. We want to make sure we don't get the mandible, get more of the frontal sinuses, and when the lateral, you're going to see all 4 sinuses possible. Okay, Angel, we're going to set up our technique over here. I'm going to do a 75 kVp. He's a male, a little bit larger stature, so we'll do about 10 masks. Go ahead and hold your breath. Beep. Okay, exposure is taken. Go ahead and breathe, Angel. All right, and now we'll move on to our next one. We have ran the lateral. We are going to reinsert another 10 by 12 cassette. I have my patient turn towards it because we're going to do the PA Codwell now. I flipped his shield here, so since the CR is coming in through the back, to shield him as best we can. Next, we're going to have his head is towards the board, so we're going to have his OML about 15 degrees from the CR. Our CR is going to be perpendicular to the bucky. Also, same thing, 40 inches. I'm going to have this is his right side PA, so I'll put its marker. All right, so Angel, don't move. Make sure our CR is directed. It's going to exit the nasion. So don't move. We're going to go ahead and set our technique. This is a PA, so it's going to be a little bit thicker and more dense. So we'll do about 75 kV still, and about 12 masks. So don't move, hold your breath, beep, okay? And now we're going to go ahead and take our cassette and go run it and check this image for the next one. Okay, so next we're going to do our waters view. I'm going to put my imaging plate here, again, lengthwise. We have Angel already facing, it's going to be a PA waters, like I mentioned. So we're going to have this still 40 inches, and I have him lined up, so I'm going to push his head towards, so okay, so I'm going to have his chin put on the board, which he's going to have it straight up, so that makes his mandible-meatal line, it's going to be perpendicular with the IR, which also makes him have his OML is going to be a 37-degree angle with the central ray. So the central ray is actually going to be exiting the acampion. Next, I'm going to make sure I have my right marker on, because he is PA, make sure it's out of the light field. In the light field, but not in the anatomy. So, okay, Angel, everything looks good. He's shielded. Everything's collimated to, so we don't get too much of the anatomy. Perfect. All right, his technique is going to be about the same as the other PA, so we'll do about 75 to 10 to 12. Go ahead and hold your breath. All right, X-ray, good. So now he can relax. We're going to take this IP and go run it, and then we'll do the next. So now that we have already developed our other ones, we're going to continue on to our SMV, which is our submental vertical view. Again, we're using a 10 by 12, it's lengthwise. I have my patient here still facing the X-ray machine here. So I have his back towards it, his shield is good, he's at 40 inches SID. I have his MSP is going to be perpendicular to the IR. So now I'm going to have him put his head back. So it's going to be all the way against it. So that makes his OML parallel to our IR as well. Now I'm going to make sure our CR enters just 3/4 inch above anterior to the EAM. So it's going to be right below his mandible. We're going to have a nice clear view. Make sure we collimate. And and then I have my left marker on. So let's go ahead and do the exposure because that's an uncomfortable view. So we're going to have the same thing, KB, it's still a skull for sinuses, 75 and our 10 to 12 mass. So go ahead and hold your breath. Beep, okay. Go ahead and relax your head, sir. I know it's kind of strenuous, and then I'm going to pull out my IR and go
I think
so
I need
we're
a
going to move on to the mandible. It's going to be our mandible rami. So we're going to do a PA again. This time we're going to have our CR perpendicular to our IR, and our IOML is perpendicular to the IR. So we're going to have our forehead and the nose against the IR here. We have our right marker already. Make sure the bucky and the tube are lined up. Collimate just down to above the mandible because we don't need the whole skull on this. And make sure our CR is exiting the canthion. So everything is shielded, ready to go. My technique is going to be about same as the others, 75 to about 10 mass. So go ahead and suspend respiration, hold your breath. Okay, beep, and breathe. Now we're going to take our cassette and run this and move on to the next. So next we're going to do still the mandible. We're working on the mandibular body. And last time we were looking at the rami, so we want to look at the rest. We're still doing PA, so he's shielded, he's still facing the IR. His MSP as well as the AML is perpendicular to the IR here. So I'm going to go ahead and make sure he's pressing up against it. And so for our central ray, we want to make sure that it's nice and collimated, and the central ray is going to exit the lips, so just below the AML. So collimate. Good, don't move. Have the marker again outside of the anatomy, but within the light field. Collimate, nice and tight. Next, our technique is about 75, still at about 10. So go ahead and hold your breath. Beep. Okay. So now we're going to go run this and move on to the next one. Okay, so next we're going to move on to the other submental vertical, which is the same as we did before, but now we're going to look strictly at just the mandible. So again, same side, we can even do an 8x10, just collimate nice and tight. We're going to lean his head back, so fully extend the neck, and it's going to make the IOML parallel to the IR. And then next, of course, we're going to have our CR, and we're going to have it right in between the two angles of the mandible. So without further ado, because we don't want him like that too long, because it's kind of uncomfortable, we're going to collimate just to get the mandible, and then have our marker to the left side. Our technique is already set up from the previous, so it's 75 at 10 mass. Hold your breath, sir. Beep. Okay. Go ahead and relax your head. Grab our next cassette and go run it and move on to our. Now we're going to do the lateral view of the mandibular rami. We already did the PA, so now to see our lateral view, we're going to do the intrapupillary line. We're going to do it perpendicular to the IR. So get as close as possible. Add this shield on him. It's covering him as much as possible. Now we are going to center our central ray to mid-mandibular line, right up here. So to do so and throw it off so they're not superimposed, we're going to angle our tubes cephalically to about 25 degrees. So put it right up there. Go ahead and push your chin a little bit back. Perfect. Okay. I'm going to collimate because I only want the mandible, so about just above the EAM. Make sure we have our marker there. Nice and chin, sitting nice and tall. So go ahead and relax. And I'm going to set my technique. This is a lateral, so I can go just slightly down with my mass. So I'll do about 75 kV and about 8 to 10 mass. So go ahead and hold your breath. Okay, exposed. Go ahead and relax. I'll take this out and we'll go run our image. Now we're going to do the zygomatic arches. We're just going to do 2 projections. Our first one is going to be the SMB, just like the other ones. Our CR is going to be different. So again, extend your neck all the way back as much as you can. We are going to have them centered and have the CR go directly 1 inch posterior to the outer canthi, and we're going to make sure our IOML is parallel to the board. So everything is ready. I have my cassette in here. Everything's lined up, 40 inches SID, okay? So go ahead and hold your breath. Beep. That one we cut you can go ahead and relax. That one we cut the mass from the other ones because we don't want to burn out our zygomatic arches. So I did about 70 kV to 6 mass. Okay, this next one we're going to do our modified town, which zygomatic arches. Again, I have my 10 by 12 cassette in here. It's already detented. This time I'm going to angle my tube 30 inches cotted. Make sure I collimate. Okay, I already have my left marker here. He is straight, so he's going to have his OML perpendicular to the IR. So our CR is going to enter about 1 inch above the nasion, which is right at the glabella. So everything looks good, he's shielded, and I'm going to do my exposure. Just hold your breath, beep. Okay, so he's all done. That mass is also about 70 at 6 to 8, because you don't want to blow out zygomatic arches like in the other projections. And that's it for our exam.
The lateral projection is done to see all 4 sinus groups. So you see your sphenoid here, where your salturcica, maxillary, ethmoid, and frontal sinus. A good image shows superimposition of the mandibular rami, and clearly see if there's any fluid levels. The paaxial Caldwell method is done to see your frontal sinuses and ethmoid sinuses. To verify if it was a good image, you would look for the petrous ridges in the lower third of the orbits. This is an image of our Waters view. It's to see mainly our maxillary sinuses here, and you can see our mastoid air cells down here. Here your frontal and ethmoid sinuses are going to be elongated, so mainly just see your maxillary sinus clearly. To make sure you have a good Waters image, you're going to see the petrous pyramids lying immediately inferior to the floor of the maxillary sinuses, right down here. This is our SMV view of our sinuses. Here you're looking for your sphenoidal sinus down here and our ethmoidal sinuses. You can see clearly. This also demonstrates clear view if we have any air fluid levels. This is our image of the PA projection of the mandibular rami. For a good image, you want to see proper collimation and both symmetric sides of the mandibular rami. This will show any fractures in the rami. This is our PA projection of our mandibular body. In this one, we just want to see symmetrical sides of the body on both sides. This is our submental vertical view, which is also known as our SMV for our mandible. This one we want proper collimation to have the entire mandible, and you want equal distance in between the lateral side of the skull and the mandible. You also want to make sure you can see your condyles and your coronoid processes in here. This image is of the mandible rami for the lateral view. This one you do not want to see the ramus overlapping by the opposite side, and you basically just want to have proper collimation to see the entire mandible. Here again we have our SMV view, but this time it's of our zygos. On this one you want to see clearly the zygos here on both sides. We use lower mass, that way they were not burned out, so they're shown nice and clear with no overlapping or anything else in its way. Here we have another view of our zygomatic arches. This time they're a little more elongated, shown in our modified Towns projection. This one you also want to see that your zygos are not overlapping or superimpose any other projection, and they are symmetrical on both sides. And that sums up all our images for our sinuses, mandible, and zygos.